All right, we're going to get started here. Thank you so much for joining us at the James Mander, I'm going to say Recreation Complex, okay? Look at all of this. Look at all of this. Isn't this beautiful? Isn't this beautiful? Give Strawberry Mansion and James Mander a round of applause. Look at all this. Enough basketball courts for our very ex-athletes to get out there and embarrass ourselves. Thank you to all the folks here at Mander for welcoming us on this day. Where's Miss L? Where's Miss? Thank you, Miss L. Hey, Governor, she gave us permission. She gave us permission. All right, be out here. Thank you, Miss L. All the folks, and to my main man, Rick Ford, or by his government name, Derek Ford. All right, we want to thank you for having us, hosting us, and doing the incredible work that you do on a daily basis. Really, it is the life of our community, and the more we can do to help you do your thing, the better off we all will be. Just a quick PSA, if you will, the Pfizer shots are being distributed right now, first and second, okay, first and second, and they'll be here until around 2 p.m. So if you need to get that, now's your opportunity. Now's your opportunity to get it. Thank you once again to great folks at Mander for doing the good work. As I said, I'm State Senator Vincent Hughes. We are here welcoming our governor to talk about a very important program, a necessary program to help us confront this still ongoing pandemic of COVID. We are still suffering, although great progress has been made in the Commonwealth of Pennsylvania in an environment that sometimes almost would be considered madness in terms of folks getting health care, getting treatment, taking the test, getting the vaccine. Seems it would be a simple thing to address, but unfortunately, it's not been that simple. But thank you, Governor Wolf, for leading this Commonwealth to be, I believe, about 9th in the country, 7th in the country, hot off the presses, 7th in the country with respect to folks getting the vaccine, and that's a good thing. But we need to do more. We need to do more. There are communities, and I'll focus here in the city, that are severely undervaccinated, and unfortunately, they are severely unvaccinated, and clearly, when you look at the numbers, they are majority black and brown. If you go to the Overbrook section, 37%, 38% vaccine rate. The Logan section, 38% vaccine rate. The Winfield section, 40% vaccine rate. Dunlap, 41.5%. West Oak Lane, 42.4%. Eastwick, 43%. Elmwood, 43.7%. Fairhill, 44.2%. Somerton, 44.8%. Alany, 44.8%. 9 of those 10 neighborhoods, 9 of those 10 zip codes, average 90% non-white communities. Those are largely black and brown communities. And so we need to get extra strategies in place, extra working space, and to do that, working with the governor, and I'm going to turn it over to him in a second, we've driven out about $5 million to go to neighborhood-based organizations, Mander, neighborhood-based organizations, to get the help necessary so they can drive the message, put boots on the ground, feet in the community, get out to NETA in neighborhoods, and make sure that folks get the vaccine. To provide more detail, I can't thank enough Tom Wolf, who is our governor, who's led with a steady hand in a very difficult environment to move the state forward in terms of getting us healthier and putting us in a better position to advance our recovery. If you will, please welcome Governor Tom Wolf. Governor. Just something new, man.
Thank you, Senator Hughes, and thank you, everybody, for joining us. Senator Street, thank you for being here. I said hi to everybody else. Representative Brown. So it's great. Where's Donna Bullock? Donna Bullock, sorry, Chairman Bullock. So thank you all for being here and helping us to beat COVID. As Senator Hughes said, there are a couple things. First thing is the vaccination is our strategy, and it is working. I said we were 7th in the nation. That was as of this morning. That's in first doses as percentage of the total population. I'm not sure what our rank is, but we're close to 90% in terms of adults 18 and older. I think 88 point something percent of all Pennsylvanians 18 and older have gotten at least one dose. And this week, we just passed the 70% mark. We're 70.1% in terms of adult Pennsylvanians who have become fully vaccinated. So overall, we're doing a great job. And the vaccine is the key to our getting through this pandemic. And I want to thank Senator Hughes for his hard work to protect the public health throughout this pandemic. He has been a stalwart champion of everything that we could possibly do to keep ourselves safe. And he's also in the front of our encouragement to folks in Pennsylvania to get the vaccine. Ever since vaccines became available in December, we have been doing everything we can to get this message out. This is our strategy, and I think it's no accident that Pennsylvania is one of the best states when it comes to vaccines, and we're one of the last states to see the upsurge in Delta, and we're actually, as it moved from the southwest and south, north and northeast, right now the nation is actually seeing a decline in the rate of increase. Pennsylvania is flat right now, and the region is actually down. We're right in the middle of the region. We're actually better than Ohio, West Virginia, and Delaware, and we're worse in cases per 100,000 than New York, New Jersey, and Maryland. But all of us are seeing either a flat or a decline in the rate of increase. So all of the folks here are doing a phenomenal job. We're doing a good job in Pennsylvania, and especially here where it's really important. You folks here are doing hard work to combat misinformation, the misinformation about breakthrough cases, the lies that people have just sown, and the distrust to reduce vaccine hesitancy. This type of outreach is crucial for all of our communities all across Pennsylvania, but it's especially important in minority and vulnerable communities that have historically been disregarded or in some cases been taken advantage of by the medical establishment. So the point is the COVID-19 vaccines are safe, they're free, and they are readily available. And they're they are the road out of this pandemic for all of us. One shot at a time, we can get through this. But for communities where hesitancy persists, the best person to talk to about why vaccines are important actually might not be me. And Vince, it might not even be Senator Hughes or Representative Bullock. I'm not sure, but we want to get the message out in the mouths of people, hands of people who can actually spread this message and are going to be listened to. And that's why my administration launched the COVID-19 Vaccine Outreach Grant Program to put money and resources into the hands of the best people to do this work. As Senator Hughes said, that is $5 million. It's a grant program that supports the efforts of local organizations, grassroots organizations, conducting outreach about COVID-19 vaccines. This is not going to big institutions. This is going to outreach to organizations in tranches of $10,000 to $100,000. These organizations include nonprofits. They include child care institutions, educational institutions that have built trust in their communities. They're using their established relationships to raise awareness, to reduce hesitancy, and address barriers to vaccine access. Applications for the grant program are open through November 1st, 2021. And anybody interested in applying can learn more on the Department of Community and Economic Development website. That's dced.pa.gov, dced.pa.gov. And I would encourage all eligible organizations to apply. We want to support your good work to protect your communities and help all of us end this pandemic. Getting every eligible Pennsylvanian vaccinated is our goal. And that's what we need to do to end this pandemic. And innovative programs like the ones that these organizations are going to foster are going to help us get there. And this $5 million is going to help us get there. I encourage, again, all Pennsylvanians who have not yet been vaccinated to visit a pharmacy, visit a vaccine clinic, and get your shot. Don't listen to me. Listen to all the people who are talking about what a difference vaccinations can make in each and every community. Each and every community is different, but all communities need the vaccine. So thank you, and now I'm really pleased to turn this over to Representative Amon Brown. Representative.
Thank you. Good afternoon. Thank you, Governor. Thank you, Senator Hughes, and thank you to the rest of my colleagues that are here today to share information on the importance of getting vaccinated. We are here today to express the importance of getting vaccinated, especially in Black and brown communities. Like everyone mentioned, the numbers are extremely low compared to our counterparts. I myself was very hesitant at first, but then I decided to make the choice to protect myself, to protect my family, and to protect my community, because those who know me know I'm always out in the community doing as much as I can do to be helpful. We need to be doing all that we can do to educate and inform the community to address the misconceptions and the hesitation. That's why I'm thankful for this grant outreach program, and I believe this is the way to do it. The COVID-19 vaccine outreach grant program provides grants up to $100,000 for all efforts, and these efforts include educating the community on why you should be vaccinated, addressing the barriers in vaccine-related community events, in social media and physical media, and more. So please, let's get vaccinated. And to all my young people out there, it is okay to get vaccinated. You will not be harmed. The vaccine is here to help you. And like I said, I was hesitant, but I'm still standing and I'm fully vaccinated. So please, everyone, get vaccinated. Thank you.
So we may not be all of Representative Brown's young people, but we're all young people, right? We're all young, right? We're all young, right? Right? I know you had your own young people, but we're all young, all right? Let me acknowledge the presidents they were mentioned, referred to earlier. Senator Sharif Street, wave hi to everybody, all right? Representative Donna Bullock, the chair of the Pennsylvania Legislative Black Caucus. Rep. Very good. We are in Strawberry Mansion. You can't do anything in Strawberry Mansion without talking with the executive director of the Strawberry Mansion CDC, Tanetta Graham. Come on up here, Tanetta.
Senator Hughes, you put me out there like that. That was supposed to be low key.
Okay.
Hi, everybody. Welcome to Strawberry Mansion.
All right.
Are we vaccinated? Are we vaccinated? Are we vaccinated? Yes, well, thank you guys for being here. Thank you all. You guys look beautiful, vaccinatedly beautiful. I just would like to tell you that you are standing at Mander Recreation Center. This is our hub here in Strawberry Mansion, where we live, where we work, where we play. Here in Strawberry Mansion at Mander, you can play basketball, football, baseball. This is where we learn how to do the electric slide. And some of our older ones, we doing a wobble now. So we done stepped our game up. So this is a major hub for our neighborhood. And when this pandemic hit, we knew that we had to do some work here at Mander. This was a site where we knew that folks would come together and get information. At Mander, we were able to vaccinate and to test over 500 people in our community. So it was very important for organizations like the Strawberry Mansion CDC to get busy when this pandemic hit. We all know the disparities that happen in communities like Strawberry Mansion. We're a 90% African-American community. The technology thing hit. Oh my gosh, how our kids are gonna go to school. We couldn't find testing here in the neighborhood. We couldn't let alone get masked. So it was important for us. We reached out to our elected officials, our wonderful elected officials, and we said we need to bring some resources here at Strawberry Mansion. We're going to do it at our hub. We're going to do it at Mander. So we were able to partner with some wonderful, wonderful organizations to get some testing done here for our residents, to get some vaccinations done here for our residents, and even some flu shots. So today you're going to hear from some of our wonderful partners, the Black Doctors Consortium. You guys know about the great work that they're doing. They were here, not once, but twice, to get our residents tested and vaccinated. We also partner with Temple's Rapid Vax. See, we're going to invite everybody to come and help get our residents vaccinated, and so we can be safe, so we can come together in this hub. We also partner with Philly Counts and Labatt Care. And by the way, we'll be here tomorrow doing a vaccine event with Philly Counts and Labatt Care. So it was important. It is important for community-based organizations to be part of this discussion because we are the connectors. We are on the ground. We know where folks need to have information given to them. We know where we need to have to dispel some of the misinformation out about this vaccine and about this virus. So we are excited to have Mander as a continued hub. We are going to continue to come here. This is our home. We're going to continue to give out information here and continue to vaccinate folks and give information out. So I thank you guys for coming and just help us all get Philadelphia vaccinated. Thank you.
All right. She did it. She did it. She did it. One of her partners, she mentioned them, Temple Rapid Vax. I want to bring up now Brianna Tawan Richardson. Brianna, where are you? Come on, Brianna.
Good afternoon, everyone. My name is Brianna Richardson from Temple University's College of Public Health's Rapid Vax project. On behalf of our project lead, Dean Siminoff, I would like to thank the City of Philadelphia for funding our efforts. Since April 18th, it has been our mission to make COVID vaccines and evidence-based information regarding COVID and its vaccines accessible to all Philadelphians. Through our community engagement efforts, grounded in cultural competency, empathy, and consistency, we have successfully helped over 4,000 Philadelphians become vaccinated. And we've also hired some Philadelphians from their own communities to become Rapid Vax ambassadors and educate their own communities on the importance of getting vaccinated. Our communications team, led by Dr. Sarah Bass, has utilized her expertise in health communications and vaccine hesitancy to design culturally competent and linguistically competent educational materials in order to help empower people to make the decision to get vaccinated. And of course, our clinical team, led by Dr. Susan Von Nessen-Scanlon, has worked tirelessly to administer vaccines with an exceptional level of empathy and compassion to make everyone getting vaccinated at our clinics feel comfortable. And last but not least, our community partners have been absolutely essential in all of our work. We couldn't have done anything without these organizations. And one of them are here today. I'd like to make a special shout out to Strawberry Mansion CDC, who has been absolutely outstanding partner for us. We have collaborated with them on multiple clinics, and they have been a true leader in the North Philadelphia community in educating people on why it's important to get vaccinated. And the Rapid Vax team, we're really excited to continue our work through this year in finding creative ways to educate and vaccinate North Philadelphians, and particularly residents in zip codes with lower rates of vaccination. If you'd like to learn more about our efforts, please visit our website at sites.temple.edu/RapidVax or follow us on Twitter and Instagram at RapidVax. Thank you.
Thank you, Brianna. Thank you, Brianna. Job well done. So remember, folks, this is focused on neighborhood-based organizations getting access to funds to help get folks vaccinated. Neighborhood-based organizations. That's why we're doing this, to make sure that the folks in the community have access to the funds, can apply for the funds, and help get the word out on vaccination. And Gov, you got a crack team. I want to tell you, you got a crack team. Since the beginning, we just got the message of the full link on the website. All right? And I'm going to put it out right now. dced.pa.gov DCED.pa.gov DCED.pa.gov/VOGP. Crack squad, Gov. Crack squad, all right? I'm telling you, I would expect nothing less, right? There you go. One of our healthcare champions, or maybe I should say two of our healthcare champions, have just, have been phenomenal. I mean, really phenomenal throughout this entire process. Since when we started on testing and getting the word out about testing, to as we move through to the vaccination conversation. Dr. Delana Wardlaw, from family medicine physician at Temple Health, and Dr. Elena McDonald, a pediatrician at Memphis Street Pediatrics. Don't get it fooled, folks. They're twins. And they refer to themselves, that's right, Governor, they refer to themselves as the twin sister docs, all right? Don't ask me which one is older. That's a personal issue, okay? All right? If we could bring Dr. Wardlaw and Dr. McDonald to the microphone now and let them tell you what they're thinking right now.
Good afternoon. Thank you for having us. I'm Dr. Wardlaw. This is my twin sister, Dr. Elena McDonald. We make up the Twin Sister Docs. Strawberry Mansion is our home. We grew up 2 blocks from here. Our family home is still 2 blocks from here. So this is our community, and we have worked tirelessly to not only educate this community, but other communities across the city of Philadelphia. We work on a mission of 3 T's: trust, translate, and transform. We are trusted messengers providing culturally sensitive, accurate medical information, and this allows it transforms into patients becoming advocates in their own health care, translated into you becoming an advocate in your own health care, and that ultimately leads to transformational outcomes. We have been gracious. We've been able to work with Senator Hughes, who's been gracious to allow us to use his platforms on his town halls and his Philly Speak show to be able to provide accurate information, to answer questions, to dispel myths. We've been honored to work with First Lady Mrs. Frances Wolf doing a Facebook Live to be able to ask questions and address issues that people have with the vaccine. Our job is to make sure that people have their questions answered, and we are here to do that. We've transitioned from providing testing, which Dr. McDonald volunteered early on in the pandemic, to vaccine education, and now we're providing vaccinations. And we are providing vaccinations right here behind us if you would like to get vaccinated today. I'll turn it over to Dr. McDonald. Dr. Wardlaw pretty much said it all. But yes, this is our home, and it is important for us to get the message out to people who look like us and to people who have something in common with us. We understand that there is a huge mistrust of the government, of the medical establishment, but we are here to say that we are physicians, we are from your community, we trust medicine, we trust the vaccine. The vaccine is safe, the vaccine is effective, the vaccine does not affect your DNA. The vaccine will not affect your fertility. The government is not putting a tracking device inside of you. Your tracking device is right here. So it is important for us to, this pandemic just exposed the healthcare disparities to the 1000th degree that have been going on for hundreds of years. We now have a very effective tool to combat this pandemic. Now is the time for us to protect ourselves, our families, our friends, our communities. Please get vaccinated. For more information about Twin Sister Docs, please visit us at Twin Sister Docs on Facebook, Instagram, and Twitter. Thank you. Have a good day.
There you go. There you go. And wasn't it kind of them for them to stand on opposite sides of the line here? That's so we don't have. Before I go any further, Mom, that's Mom right there. Mom of the Twin Sister Docs. Thank you very much. Thank you. And they say that's Dad back there. Is that Dad back there? Thank you, thank you, thank you, thank you very much for doing some great work right here in Strawberry Mansion. Please acknowledge the presence of Dr. William King. Doc, put your hand up. Where is he? There he is right there, Dr. King. Make sure they see you, Doc, all right? Okay? One of our leading pediatricians here in this area has been on the fight with us throughout the entire process, from testing all the way to vaccine and so much more. The founder of Labacare is Omalabake Fadiyibe. And we want to bring them up as trusted partners in this process of making sure that folks in the neighborhood are comfortable, are secure, that the vaccine is safe and it's necessary. Doctor? All right, that's the whole team. Okay.
I'm very short. Hello, everybody.
Hello.
And thank you, Governor Wolf, for coming out to empower us and to talk more about the vaccination, the COVID vaccination. I am founder and CEO of Labaki Organization, and this is my husband, Dr. Olu, and we have been vaccinating people in the neighborhood, Strawberry Mansion, Elmwood, all over Philadelphia. We have been vaccinating, and we have gotten so many people vaccinated, and at the same time, we are still having more work. We still have more work to do, because some people are still not getting vaccinated because of the myths, you know, like the previous speaker said, you know, there are so many myths. I'm not going to get vaccinated because I'm not going to get pregnant when I need to be pregnant, tracking devices, so many myths. But by talking to people, by educating them, we do one-on-one conversation whenever we're out vaccinating. We encourage, we tell them about the facts and the myth, and I can say that we have changed some minds. I remember the last time we were on the field, there was a 93-year-old woman who didn't get vaccinated. She didn't get vaccinated. Her daughter didn't want her to get vaccinated, and she was refusing it. Then I went to the daughter. I said, why are you not letting your mother get vaccinated? She said, my mother has to make her own decision. And I took the mother, we talked, she had questions, I answered the question, and to my heart, she got vaccinated. So we've come across so many people like that. Yes, even young women that wasn't vaccinated, several people. So we still have lots of work to do. And I'd like to thank Philly-Count, who gave us some financial assistance so that we can get some more volunteers, some more people to come out with us. So we are ready to get the work done. Labacare.org. If you want to volunteer with us, just come along. And tomorrow, we're having flu clinic, COVID clinic, flu clinic, booster dose, any dose you want. Just come out tomorrow from 10 to 2 p.m. here at Manda Recreation Center. And last but not least, let me thank Ms. Teneta and Mr. Williams of CDC of Strawberry Mansion. Without them, we won't be here. Thank you all, and God bless.
Thank you. Come on, y'all know who the boss is, okay? Hassan Freeman, where's Hassan? Okay, you were just here, all right. Thank you. Hassan, most specifically, Hassan is from Philly Counts, and the whole Philly Counts team has transitioned from obviously doing the census work, the voter registration work, the education about where the voting machines are and everything like that. They've transitioned over magnificently to the, is he going to talk? I'm going to make you say something. Say something, Governor. Say it, man.
I got to do it if the governor tells me to do it.
Right. Don't mess up, all right?
I just want to say, man, that Philly Counts can't be what we are without our great organizing team. I want to shout them out, but I also want to shout out the CBOs. The CBOs make it easy. If you don't get vaxxed for yourself, get vaxxed for somebody else. For me, I got vaxxed because my son was a liver transplant recipient. And I knew that if I got COVID, I was putting him at risk. Unfortunately, I did get COVID. But the blessing was he was already vaccinated. So if you don't do it for you, find something that you love more than yourself and do it for them. Thank you.
All right. There you go. Thank you, man. Did he do good, guy? He did good. He did good. Remember that website, dced.pa.gov/VOGP. I'm going to repeat that again, dced.pa.gov/VOGP. That's where you apply for the funding. Don't sit on it. Don't wait. Don't say, I'll do it tomorrow. Get it done right away. They tell me that decision-making process will begin around November 1, so that's kind of like when you got to get your application in by November 1, and that hopefully by the beginning of December or mid-December, decisions will be made and dollars will start to roll out. To close us out, the president of the Black Clergy of Philadelphia and vicinity, someone who's been a partner to all of us throughout this process, since the very beginning to where we are now. Countless Zoom calls, countless public gatherings, countless press conferences. Black Clergy of Philadelphia and vicinity has been there, led by their president. Please welcome Reverend Robert Collier. Pastor.
Good afternoon. I am Reverend Robert Collier. I'm the pastor of the Galilee Baptist Church and the president of the Black Clergy of Philadelphia and vicinity. I am proud to stand with Governor Wolf, State Senator Hughes, and all other elected officials, and you, my brothers and sisters, to urge all unvaccinated people to get vaccinated. I want to make a special plea to my brothers and sisters in my community. You must get vaccinated. Unvaccinated people are still dying. The pandemic is real. We're still in it. We encourage you to get vaccinated. Once you are vaccinated, you will protect yourself and your loved one. So get vaccinated. You will be glad that you did. Thank you.
Thank you, Pastor Collier. We still run into personal stories and personal circumstances about the impact of COVID, especially with those individuals who are filling up our hospitals. Got a story late last night to my docs about someone who needed surgery but couldn't get it right away because the beds were full. And this is a major health system here in this region, Governor, and to my docs. The beds were full, and they had to wait for days before the surgery could be performed. It is still real. It is still relevant. It is still necessary. And what we know is that the vaccine can stop all of this. The vaccine can stop all of this. The website, once again, and we'll open up for questions, dced.pa.gov/VOGP. Apply now. Neighborhood-based organizations, apply now. Partner with some of these individuals here. Partner with some of these individuals here. I'm going to say it again. Partner with some of these individuals here to improve the success of your application, because it's going to happen rapidly, and we know there's going to be a flow of applications throughout the process. dced.pa.gov/VOGP. And so we'll take a few minutes for any questions. We'll keep those questions on topic, and we'll go from there. Any answers? No questions, no answers. Okay, here's one.
Hi, this question's for the governor. Hi, Governor. Thanks so much for doing this today. So we know that, data collection has been a challenge throughout the pandemic, right. Particularly in, across the country, but also in Pennsylvania, but particularly looking at racial data and ethnic data and actually getting a picture of who's underserved. Can you talk about the state of Pennsylvania's data collection right now and whether you think we have enough on that racial data?
Yeah, I think we're doing a pretty good job of collecting the data. I think you're aware we have a bipartisan task force on vaccines that looks at that at every meeting, and it all says the same thing. We need to do more, which is why things like this are really important, which is why the $5 million from DCED, which is federal money that is being used for this purpose to address the issues of hesitancy in vulnerable communities, is really important. So yeah, it's something we track, and it is really important. We need to do a better job. Anything else for Senator Hughes? All right. Thank you very much.
Thank you very much. Thank you.